We're going to go ahead and get us started with the intro slides so we have enough time for our speaker. So welcome, everyone. My name is Elena Kidd, and I'm a program director with the University of Alabama at Birmingham School of Public Health Office of Public Health Practice. I'm excited to welcome you to today's webinar, Climate Change Impacts on Vector-borne Diseases, featuring Dr. Luis Fernando Chaves, Associate Professor at the Indiana University School of Public Health, Bloomington Department of Environmental and Occupational Health. This webinar is made possible by the Alabama Regional Center for Infection Prevention and Control, or ARC-IPC. The ARC-IPC was established to meet the consultation and support service needs surrounding infection prevention and control throughout the state of Alabama. The center is a collaborative effort of the Alabama Department of Public Health's Infectious Disease and Outbreaks Division and the University of Alabama at Birmingham. The ARC-IPC provides training and technical assistance to infection prevention and control and public health professionals in areas needed to detect, respond to, control, and prevent infectious disease outbreaks. You can learn more about the center, view and listen to past trainings, webinars, and podcasts, request training and technical assistance, sign up for a newsletter, and view infection prevention and control resources at the website listed on the slide, or you can email arcipc@uab.edu with any questions. We would like to thank our co-sponsors for today's webinar, the Deep South Center for Occupational Health and Safety, the Alabama Statewide Area Health Education Centers, and the Region 4 Public Health Training Center. You can learn more about their programs and centers as a whole on the websites listed on the screen. We also like to let you know about our next upcoming webinar with AC Burke from RB Partners. AC will be discussing Centers for Medicare and Medicaid Services, or CMS, reporting requirements and incentives for long-term care facilities. This webinar is presented by the Alabama Regional Center for Infection Prevention and Control and co-sponsored by the Deep South Center for Occupational Health and Safety, the Alabama Long-Term Care Strike Team, and the Alabama Statewide Area Health Education Centers. It'll be held on January 21st, 2025 at 12 p.m. Central Standard Time. Continuing education credits have been approved for nurses by the Deep South Center for Occupational Health and Safety for this program. In order to receive credit for this training, you must register for the training, watch the entire program, and complete the evaluation following the program. Upon completion of the evaluation, you'll be redirected to the Alabama Nursing CE request form, which you will also need to complete. CEUs will be awarded by the Deep South Center for Occupational Health and Safety. If you submit a request for CEUs within 2 weeks following the program, you do not have to submit directly to the Alabama Board of Nursing. CE units for this program will expire July 10th, 2025. If you experience any issues, please email arcipc@uab.edu. We will place this email in the chat box as well. And finally, it is my pleasure to introduce our speaker. Dr. Luis Fernando Chaves has a PhD from Michigan in ecology and evolutionary biology and is currently an associate professor in the Indiana University School of Public Health, Bloomington Department of Environmental and Occupational Health. He has been studying insect vectors and the diseases they transmit since he was an undergraduate in Venezuela. He has published extensively on the ecology of insect vectors, the relationship to transmission of pathogens, and the response of vector-borne diseases to climate change. Dr. Chaves has directed research projects in Costa Rica, Panama, US, Venezuela, Japan, and he collaborated in projects based in Canada, Brazil, El Salvador, Nicaragua, Taiwan, Korea, Vanuatu, and Kenya, among other places, while holding an academic and/or government position in the US, Japan, Panama, and Costa Rica. So without further ado, it is my pleasure to turn things over to Dr. Chaves. Thank you so much for being here today.
Well, and thank you for the invitation, and I hope you find enjoyable this talk and you learn a bit about what's going on with climate change and vector-borne diseases. So to start, the first thing I would like to say is that the evidence for climate change is ample, no? And we can see this on everyday news. So for example, we have seen news about floodings, droughts. We have seen news about hurricanes. Some of you might have experienced the hurricanes. Just this last month, we had a couple of them impacting the southern US. And there are other phenomena, no, that also capture some attention. For example, like what has been going on in my hometown in Venezuela, where there used to be a mountain with a glacier that has disappeared over the last 20 years. However, the key observation about climate change is that temperatures have been increasing and that those increases have been associated with increases in CO2 emissions. And that's what we see on this figure, no? Over the last 100 years, temperatures increase following increases in CO2 emissions. Now, one of the ways in which we more commonly see these increases in temperatures are phenomena that are becoming increasingly more common, as it's the case for heat waves. And what's interesting about heat waves is that they are happening in places where they didn't used to be common. For example, last year there was an outbreak of heat waves in the Pacific Northwest here in North America, but also that they affect or the health impacts of them are particularly strong on vulnerable populations. So that has been the case for the elderly, and here we see some news about California. And the thing about heat waves is that not only they affect vulnerable populations, but they might have a differential impact, no, depending on the occupation. So, for example, heat waves are becoming a major cause of health problems on people that work outdoors, like construction workers. And the situation is so bad that we can have the worst outcome that we can see related to health. That's the death of people. No, they are even becoming a cause of mortality about construction workers, as we can see here. But again, this is more about the direct impacts on human health. There is the question, okay, having this increase in temperatures, what are the implications of these increases and associated climatic changes on other health issues, particularly on the ones that I have been studying? That's the case of vector-borne diseases, no? Should we worry about what's happening with them? And well, the thing, and here we will start with a few definitions, no? What are vector-borne diseases? The key point about vector-borne diseases is that they are transmitted by vectors, no? And vectors are invertebrates, which include insects that are blood-sucking, and where parasites or pathogens can multiply and develop into infections form. No? So like once they are acquired, they multiply, and new infections can be produced when that invertebrate blood sucks again. So the most common example is the case for mosquitoes, and here you can see the life cycle of malaria, where the important thing to emphasize regarding the vectors is that they get infected on infected humans, and once they are infected, and there is this multiplication and development of the parasites inside them, they can infect an infected host, no, with malaria. Now, there are other vectors. For example, one that's very important in the US are ticks, which transmit Lyme disease. And here the life cycle is more complex, and the transmission depends on being infected on a previous life stage while blood sucking, and infecting while blood sucking at a different life stage. And there are other insects that are vectors that don't get as much attention. And we're going to be talking about one disease that's transmitted by these insects, but that will come later. So when thinking about the impacts of the environment, and especially climate change, on vector-borne diseases, we need to start by acknowledging or understanding that vectors are sensitive to changes in the environment. For example, here we can see the life cycle of a mosquito, which is both aquatic and terrestrial. It's called aquatic because some stages, like the larvae and pupae, only develop in water, and terrestrial because, well, that's where the adults have their activity and where they actually bite us. And what's interesting is, if we think about this life cycle, it is very dynamic and sensitive to the changing environment. So, for example, with rainfall, or when there is rainfall, we create these larval habitats. There is egg hatching, or the egg hatching for the mosquitoes happen. As temperature increase, the development, like how fast this life cycle happens, it's accelerated. And mosquitoes, just like humans, are sensitive to the heat waves. So for example, mosquito mortality might be increased with temperature. But not only vectors are sensitive to the changes in the environment. We have that's a situation also for the pathogens that they transmit. And that's what we can see in this image where, for example, as temperature increases, the number of days that it takes for the parasites causing malaria decreases. So is it more likely or more probable that once a vector is exposed to the pathogen, it actually develops the pathogen to the point it can transmit it, no, under scenarios of climate change, for example. And now, why the emphasis on vector-borne diseases? Well, vector-borne diseases are very important, and this is according to the World Health Organization. Around 1 out of 5 infectious disease cases that happen globally, one of those cases is related to a vector-borne disease. And just to put this in context, no, we have major diseases like COVID, and for example, here we can see the statistics of COVID after 2 years that cases started to be tracked by the World Health Organization. We see that there were 750 million of cases over that time period. There were 7 million of deaths. It turns out that just during 1 year of malaria transmission, we have approximately the same number of cases and near 2 million of deaths. We might argue, okay, the disease is not as lethal as COVID is, but the thing is, for malaria, there are cures, there are treatments, there are ways to prevent it, yet still the deaths are happening, and the number of cases continue to be as large as the number of COVID cases, as we can see. So we are in this situation where we have these blood-sucking insects that are health hazards that can transmit pathogens. Some of them might transmit arboviruses and parasites like malaria. The interesting thing is that not all mosquitoes, for example, are deadly. No, just to put an example, here we can see the bamboo mosquito, which has no impact on health. It doesn't transmit any pathogen to humans and actually interact with the mosquitoes that transmit the diseases in a way that can control their numbers. And the other point about vector-borne diseases is that there is a high diversity of blood-sucking insects, no? There are, for example, kissing bugs that transmit Chagas disease, and then there are sandflies that transmit Leishmaniasis. The thing about these last two diseases I mentioned is that they might not be that well known, and that's because those diseases are neglected tropical diseases. Most of the cases tend to happen in impoverished or affect populations that live under impoverished conditions so that they don't have as much of a material wealth around them. They are called tropical because they tend to be clustered in tropical and subtropical regions, though they might happen in temperate areas as well. And it's a continuously increasing list, no? Because a lot of these diseases, a lot of these pathogens are just even being described. The other characteristics of these neglected tropical diseases is that several are vector-borne. And just as example of neglected tropical diseases, one that's very common is snake bites, which is not vector-borne. There is dengue and many other arboviruses that might be or that can be transmitted by mosquitoes, specifically by Aedes aegypti and other related mosquitoes. There is the Chagas disease that I already mentioned, transmitted by kissing bugs. And there is Leishmaniasis, no, which is transmitted by sandflies and is a disease about which I want to talk a little bit more, given that's not that well known, that's a neglected tropical disease. So Leishmaniasis is a disease that infects approximately 12 million people around the world every year. There are limited tools to control this disease in terms that there are limited tools for vector control and even for the diagnostic or the proper diagnostic of the disease. The treatments that are out there tend to have issues of accessibility, meaning that they are too expensive for the people that tend to get the disease, or that they have toxicity issues, no? Like the ones that tend to be more affordable, then are too toxic in sometimes or most of the times. It is better not to use them given the health problems associated with their use than actually using them to cure the lesions or the infection or the problems with the infections by these parasites. Most of the cases that occur in the Americas are cutaneous, and that's the case for Panama and Costa Rica and these are places from where I will be showing some results. And again, just as it happened with all of the vector-borne diseases, both vectors and parasites are sensitive to environmental changes. So in terms, or when we think about environmental changes, one of the ways to go over this problem is going beyond what's local and thinking at the problem as a global problem, no, as the global climatic change. And one of those phenomena or indicators that's coupled with the increase of temperature is changes on normal oscillations of the weather, no? And for example, one interannual weather cycle that's very important is the El Niño Southern Oscillation because it's teleconnected. So like when you have changes on this oscillation, you see changes in the weather in several parts of the planet that occur at the same time. And well, and just to briefly go over what's the El Niño Southern Oscillation about, here we can see the Pacific Walker Oscillation. That's basically a movement of air from the Eastern Pacific into the Western Pacific, where we see the accumulation of clouds is where we have plenty of rainfall under normal conditions. And this circulation is associated with normal conditions in water temperature. No? So whatever goes and happens in the air and is related to evaporation and rainfall is related to water temperature in the ocean, specifically in the Pacific Ocean for the Walker circulation. So when we have El Niño, what happens is that temperatures increase in the Pacific Ocean, and that's what we see here by this yellowish color, and the circulation changes. No? Now the winds go from the west to the east, the areas where evaporation happens, rainfall happens, changes, and here we can see those changes mapped. No? For example, in the southern US, we have more wet conditions, we have more rainfall, and for example, this is what happened last year. Often these changes go accompanied by the next phase, no? Water was hotter, now we have the situation where water gets colder, no? And that's the cold phase or La Nina conditions, where we see again the circulation going from the east to the west, changes in the areas where there is evaporation and precipitation, and specifically, for example, in the southern US, we see a situation where conditions become drier. Now, how is this important for diseases? Well, we can make hypotheses about what happens with the transmission. No? For example, hotter conditions in some cases might be translated into more transmission. In some cases, it might be the more wet conditions. And we can inspect that. So to do that, for example, once we studied changes in Leishmaniasis transmission in Panama, and here you can see a time series of cases of Leishmaniasis in Panama. Here you can see the water temperature in that area that's relevant for El Niño Southern Oscillation. And what we did is we color code things. No? For example, when conditions are normal, we see in black. When conditions are hotter, we see the green color. And for colder conditions, we see blue. Here we see the cases. It doesn't take that much of an effort to see that during the cold conditions, actually the number of Leishmaniasis cases increases, and that's associated specifically in the case of Panama with increases in rainfall. That are somehow illustrated by this bottom panel, and not so much change and not so many changes in temperature, because again, there is the global impact of the change, but the changes in each locality might be very specific. So is this information useful? Well, it is. For example, something that we can do is we can model the new number of cases, for example, for a full country. In this case, is data from Costa Rica. And we can do forecasts and check how accurate are those forecasts. So for example, in this table, the closer we get to 1, the better that our forecasts are. And what's interesting is that using several modeling methodologies in general, the best results were observed when we consider an index for El Niño Southern Oscillation. A lot of this information also has the advantage that is publicly available and provided by agencies like NASA and NOAA. And well, they allowed us to see what's changing on the weather and to make this type of hypothesis know of how might be climate change impacting different neglected tropical diseases, different vector-borne diseases. And what's going on? Why does this happen? Well, there should be a link with the vectors, and that's what I want to illustrate here. In general, and this is a pattern for all vector-borne diseases, here I'm illustrating it with Leishmaniasis again. Here, what I plotted was the number of sandflies for an standardized amount or trapping effort. So even the same trapping effort, we can have different densities of sandflies, for example, and the number of cutaneous leishmaniasis cases, in this case in Panama. If we see as the number of sandflies increases, the number of cases increases in general. But the other thing that we see is that, for example, during the cold conditions of ENSO, for low densities of sandflies, the number of cases also increases, no? Which highlights the importance of climate change for the transmission of vector-borne diseases, as changes might also be related, for example, to changes in the relation of the parasites with the vectors. And that's, for example, what might be happening at these low densities, no? And this is important because, again, or useful in the sense that we can use this to develop mathematical models that help to better understand what's going on, to make predictions of how much of a problem are vector-borne diseases going to become at a given place, and obviously to do everything possible to prevent the transmission, to reduce their transmission, or even eliminate them, not to make them not a major health problem. So in the case of vector-borne diseases, for example, one model that has proved very useful to make or to understand these relationships is that of vectorial capacity, where vectorial capacity is an equation, no? And here we can see the equation that I'm going to navigate soon. But where basically conceptually what we are measuring is the number of secondary infections that can be generated from human infections in the presence of vectors, no? It's a very ecological concept. A lot of the parameters that we see in this equation are related to vector populations. So for example, the abundance of vectors, and that's the M, their life history strategy, like how, and here, for example, that's captured by the mortality rate, know how quickly do they die. Their foraging, and that's the V, and that's related to how do they bite, how often do they bite, where do they bite. And this gives, again, ideas about strategies to reduce transmission for these vectors. So for example, we can suppress the vectors, we can increase the mortality, we can decrease the total abundance of vectors around households, for example, and we can also reduce contacts. No, we can prevent the bites by different methods. So in general, for vector-borne diseases, in light of climate change and how to reduce their burden, we can apply ecological principles to reduce the transmission and to understand the role of the changing environment. However, here, this is something I want to argue, we need to look more widely at the problem. And to that, I want to show you again some data about cutaneous leishmaniasis, in this case from Costa Rica. And here the key observation, first I want you to focus on the maps to the left, where you can see that in general, the darker colors mean more transmission of leishmaniasis, that more transmission of leishmaniasis is concentrated on the southern-borne and the northern border of the country. And if we look, for example, at an index of social marginalization, we can see that those are the places where poverty and the less or the not so optimal state of human well-being is concentrated, no? We can look at the maps, we can also look at the data here in the plot, and we see that as marginalization increases, the number of cases increases, showing that transmission in general for neglected tropical diseases, but more generally for vector-borne diseases, is concentrated where poverty is common. So, and in making the linkages about between poverty and transmission, something that has become key or a clear linkage not related to the risk of transmission is the quality of housing. Here you can see some pictures of different rural houses in Panama, and this was on an investigation done with the Gorgas Institute from Panama. You can see that it's highly variable. No, it's different from the US. You have like houses that are with concrete, air conditioning, and somehow resembling of what can be a average house unit in the southern US. But you also have houses made of wood with zinc roofs, different environments around those houses, no, like some that are well kept, some that are not so well kept. And you can even see houses that had mud walls and thatched roofs. So all of these can be measured by those indices like the marginalization indices where, for example, from the human perspective, we have a socio-economical gradient. However, from the vector perspective, what we have is something that's an ecological gradient that, for example, the model for vectorial capacity doesn't capture yet. So thinking about housing and its impacts, and how it might be a barrier, for example, for vector control. One of the studies that we did in Panama was about evaluating the insecticide thermal fogging. This is a way to deliver insecticides to kill the vectors and to reduce transmission as expected by the vectorial capacity equation. Here we mark with an S the houses that were to fog, with a C the houses that were a control, like you do in any control trial. And well, we analyze and describe the houses, and that's what you see in this upper panel. The larger the circle that you see, it means the worse that the conditions of the housing unit were. So like the very small ones are, for example, the houses made out of concrete. The very large ones are the houses with mud walls and thatched roofs. And what we observe is before doing any insecticide, if we go there and we put traps to collect sandflies, those houses with the lower quality will have most of the sandflies. If we do the intervention, we use the insecticide and we keep measuring the sandflies, actually those houses with the poorer quality get more of the sandflies. And actually, if we do this many times, those poor quality houses actually keep getting more and more of the sandflies, which was not only related or was not only expressed in number of sandflies, but actually in number of cases in this like village level study, to the point that actually we could predict no, that as the housing quality decrease beyond or a certain threshold, no, measured by an index, the probability of getting sandflies and being infected was orders of magnitude higher than in the high quality housing. This is not unique only to Leishmaniasis. For example, here we can see some results about malaria historically from the 1950s up to the 2022 in Costa Rica, where we see that, again, the same pattern, no? If we just look at housing quality, the counties with the best housing quality in Costa Rica through time are the ones that have the less number of cases. The counties with the worst housing quality, and that's indicated with colors, not the ones that have different colors, are the ones where we have most of the malaria cases. And what's interesting is that even as the housing quality improves, still the houses or the counties where housing is left behind still have a major issue of malaria transmission. Now, again, the patterns are not unique to malaria and leishmaniasis. They are also common or shared by other neglected tropical diseases. For example, here we can see again a map showing the number of snake bite cases by county in Costa Rica. We see that they tend to be higher, no? The darker colors, we see those close to the borders, the border with Panama on this side, the border with Nicaragua to the north. And again, the disease or the snake bites clustering where poverty is clustered. The other interesting thing that we see, and this case is very particular, is that the risk increases both during the hot and the cold phase of El Niño Southern Oscillation. So during those climatic special phases of this global climatic phenomenon, we see more snake bites happening in Costa Rica. So then there is the question, no, how predictive is one disease of the other? No, how are we in a situation where we are in the presence of a syndemic, no, of looking at many diseases occurring in the same place, given that there are the common conditions? And the answer is yes. Here you can see results from an analysis that we did about COVID, malaria, and dengue and West Nile virus, comparing different regions of the world, no, Texas, Chiapas in Mexico, Costa Rica, Panama, and Brazil. And in most of the places, the only exception was Costa Rica that did relatively well with the COVID transmission. In general, areas that had issues of vector-borne diseases were areas that were more vulnerable and that saw a larger number of COVID cases. Anyways, the big point to highlight here is that whatever is going on in places like Costa Rica and Panama, patterns are very similar in the US. And a lot of these things might be related to things that are changing in the US that are not necessarily related to climate change. So for example, in the early 2000s, there was this classical study about why was there no dengue cases now north of the Rio Grande border in Texas, while there were major epidemics south of the Rio Grande border in northern Mexico. And the conclusion was that the Texas lifestyle made a big difference, limiting transmission of dengue virus. A major study, it showed that people tended to spend more time indoors in Texas, have a better housing quality, they have air conditioning and stuff like that. That didn't happen south of the border. Now, what happens if Texas is not Texas anymore? Well, socioeconomic conditions, for example, have been going down in the state of Texas. We have been studying the mosquitoes there around the border on the same areas that they went 20 years ago. And we are actually finding that depending on the income, no, for example, houses that had a lower income, their probability of higher an increased number of dengue vectors increased up to 5 times. Again, poverty rates are increasing in Texas, and this is just not in the border. We can see it, for example, affecting the Texas Panhandle, where again, poverty rates are similar to what's observed in places in Latin America. And where we see these situations, no, where we see these landscapes that resemble those that in Latin America are associated with the transmission of vector-borne diseases. And again, it has raised the question, no, that Dr. Peter Hotez put on this 2018 editorial in the journal, Plus Neglected Tropical Diseases, where he mentions, well, Texas is not Texas anymore, and actually is becoming highly susceptible to all of these diseases that we used to think were their problem and now are a common problem here in the US as well. So in light of these common patterns, one of the questions is how can we use this information to serve the communities? Diseases and vector-borne diseases in general are sensitive to climate change. There is increased transmission in some cases during the hot or during the cold phases of El Niño Southern Oscillation. neglected tropical diseases are common where poverty is common. And again, poor quality housing and low socioeconomic indicators are good predictors of where to find these diseases. And the other thing is a lot of these diseases have common causes or are associated with issues of housing. Also, we can also move into trying to find solutions that fit all of these diseases at once. Housing quality is a one that, or is one that's being highlighted, no, because it can reduce the transmission of most of these diseases, but more generally improve the health and well-being of people and even reduce the risk of things like the heat waves that I mentioned at the beginning of the talk that have direct impacts on human health and well-being. And then we can also think on how to develop more community serving science, no, where we both serve communities while also having a hypothesis-driven science. Thinking about the housing quality here on this video, you'll see its evolution in Costa Rica through time. Basically, you see how through time housing quality on this axis has improved. Here I highlight in the counties where malaria has been clustered historically in Costa Rica. And what we observe is actually that those counties, especially in terms of housing quality, not so much with water access, and that's what we have on the y-axis, tend to be lagging behind. No? They tend to be in the lower fifth or in the lower 20% of the quality. No? They tend to be actually the worst quality housing is where we have these diseases persisting. And again, it's the evolution of housing, no? Where we had houses that are sort of more lower qualities where we have malaria, for example, persisting in Costa Rica. And this is an issue that goes beyond the impacts of climate change, no? Like it's what creates that vulnerability to the changing environment. And again, even when we think about these housing issues, they aren't necessarily a thing of the global south. As you know, one of the things that, for example, happened with the Hurricane Helene, especially in North Carolina, was the destruction of housing, where we have these conditions, people living in tents over here more than a month. It has exacerbated undergoing problems. So in some places, it's not people that became homeless because their houses were destroyed. It's communities that already have plenty of homeless people being an issue. And that poses the point, no, like what will happen when we have like this storm of people, for example, not having proper housing and malaria transmission happening locally in the US as it happened last year. Like, for example, last year when this happened in communities that didn't have these issues. What will happen in a place where most of the people are living in tents, no? And what does that imply for the prevention of these diseases as we look into the future in terms of climate change impacts on health? So there is a question about how to best serve community. Earlier this year, some colleagues and I published this paper that goes into details about ideas on how to make compatible this community serving research that's also hypothesis driven. And again, what we have learned through time, for example, in Panama, working with the Institute Gorgas, is the importance of letting communities reappropriate the knowledge, you know, like not going just there to do the research, but actually at least making sure that everyone understands what's the biology, the ecology behind the diseases that affect their community and what can be done to prevent them, not beyond what we can achieve with the research or the interventions that are external. Other dimensions of this is, for example, having targeted conferences, no? Like while I was in Costa Rica, we did a malaria congress that actually brought like super experts to talk actually to people working on vector control, no? And people actually engage on the operations related to malaria elimination in Costa Rica. And these are the type of things that we can do to make a big difference. That being said, that's what I wanted to present today. I think we can go with the questions now.
Yes, thank you so much, Dr. Chaves. That was a really interesting presentation, and I think gives people a lot to think about, and especially with, like you mentioned, some of the recent disasters that have come about. Just a lot to think about, and especially public health's role in trying to educate, to raise awareness for this issue, because it's not going away. We did have a couple of questions that came in. So the first question is the level of insecticide fogging negligible relative to the impact of sandflies mitigated, or was that not studied? And I think that's going back to where you used the fogger, but is the level of insecticide fogging negligible relative to the impact of sandflies mitigated?
Well, we did study the impact of the insecticide. One of the big issues, and again, that's what I wanted to emphasize on this talk, is that those impacts were very transient, no? Were very transient, that they have like a short lifespan. They did reduce, and they reduced up to 80% the number of sandflies, but that impact lasted less than a month. And again, in the lowest quality housing, we had infestations that were at the level or even larger than what we observed before the intervention.
And so then another question we had is, you talked a lot about models to predict vector-borne diseases, and you mentioned about housing. Are there any other mitigation strategies that are useful in decreasing transmission when vector-borne abundance is predicted to be high?
Well, there are a lot of things that can be done related to behavior. So this is a very good question and sensitive in the US. For example, a lot of the Lyme disease cases are related to people that go into the outdoors without proper clothing. Then the ticks get attached to them, then they get Lyme disease. In the case of Lyme disease, is a classic example where if prevention is done through major changes on the behavior of people that go outdoors, there will be a decrease on the transmission. So, for example, the behavioral one is a good example. Source of modern solution is the case for housing. Again, for the emergencies in transmission, insecticides are definitely a great tool. However, we want to go beyond what we use for the emergency. You know, we want to look at stable long-term solutions, and that's like why I emphasize so much the housing issue. The other thing about housing is, again, that it's not only about vector-borne diseases, it's about other aspects of human health and well-being. It's not the same living in a tent like what's happening in North Carolina right now with a lot of people that lost their houses than having, for example, access to a trailer or a more uh, dignified housing unit, no, where to live, where to reside.
And I think that leads really nicely into another question that was put in the chat box, but would housing, what would be your personal recommendation for improving housing to reduce transmission? Is that the route that you would undertake for transmission reduction? I guess what would
Okay,
housing look like?
okay, well, in the case of mosquitoes, there are the things of making the housing mosquito-proof. This is done primarily using the screening, no, using the meshes that avoid the entrance of mosquitoes into the houses. Other aspects that are important, for example, it's air conditioning. But again, that might be kind of a high cost in some settings, but definitely the meshing, actually having research on how to build more economic housing with locally sourced materials. There is plenty of this type of research going on in Latin America related to Chagas disease. For example, historically it was done in Venezuela, know how to reduce the cost for housing that was not good for kissing bugs. And again, it was pretty interesting, you know, like how changing the supply chain of materials for housing, making it more local, using local materials was one of the strategies to reduce those costs. Similar efforts have been done recently in Guatemala, where again, one component was actually improving the quality housing itself. Another one was about improving water quality locally, you know, like how to get clean water into houses using local sources and local ways to purify the water. Um, There is plenty of research ongoing in Africa, no, in this respect, no, like for example, how to modify the IPs in rural housing in Africa, and it's interesting this emphasis on the IPs is because the Anopheles mosquitoes that transmit malaria enter to the houses through the IPs. So if they become mosquito proof, that's enough to reduce the amount of malaria transmitting mosquitoes inside the houses and actually to control malaria. But again, I'm personally more of an advocate for the multi-target interventions, no? Like it's how to improve the housing for many aspects of health and well-being. And I think that's where the research needs to go on to be more impactful, no? And even like cost efficient, how to reduce the cost of preventing not one disease, but many diseases at once.
Very interesting, kind of multi-pronged approach. Do you think that the dengue cases observed in the Northeast United States this year are related more so to climate change or lower housing quality?
Well, again, it's difficult to have a definitive answer without looking at the data. But I mean, my hypothesis is that the two things are interacting. And again, what we need to avoid, here is a big point I want to make, is blaming climate change of everything. A lot of the inequities or vulnerabilities to these diseases are in place. No, it's like, and I mean, I'm not alone saying this. Like people like Peter Hotez from Baylor University had said this also. No, like things like that phrase, Texas is not Texas anymore. There is a new Texas. There is a new US where socioeconomic inequities are increasing. No, and where, given that we have those underlying inequities, those underlying vulnerabilities, the exacerbated conditions for the transmission of vector-borne diseases that climate change bring into place uh, might make more probable or more possible the transmission of these vector-borne diseases.
Thinking about the education or reappropriating the education about vectors and vector-borne diseases to the communities that are affected, how do you think this can be implemented in the US, especially since we are seeing more vector-borne diseases, but it may not be on the forefront of climate change or the forefront of public health, really?
Well, I don't know. Again, like an example I have been given some thought over some time is this one of Lyme disease. And again, this is a disease that's very common, for example, in the Northeast, no, Massachusetts and places like that. It's pretty interesting. I haven't seen any sensitization or campaigns to make people more sensitive about the need to dress properly to go into outdoors, no? Making the point, oh, these places might be infested by ticks. It's not such of a great idea going into the woods using shorts, going into the woods, not using any permethrin on your clothes or not spraying permethrin on your clothes. And I don't know why it's not that happening, like why there is not the warning, no, about the risk of certain behaviors, for example, on getting ticks attached, or actually inspecting yourself for ticks attached when you go out of the woods, of the outdoors. I think that that's probably not that it's expensive, and it's something that can be readily done. There are other examples, no? Like another example that comes to mind is, and again, here there are no vectors, but we get into the realm of neglected tropical diseases. Like hookworm is common among the poorest rural communities in Alabama. And a lot of the issues are related to water and how wastewater disposal, no? For example, in those cases, there is the larger need to improve the not even the housing, but actually the wastewater disposal, no? Not or moving from septic tanks into waste management that's different from septic tanks, no? That's more fluid, that it's interconnected, and that can remove the waste from the place that can treat the waste in a ways that, for example, the eggs of hookworm disappear from the environment. So there are multiple approaches, and again, it's like what works best depends on the type of problem, on the type of locality.
Thank you. And we have a couple more questions that keep coming in. But one other question we had coming in is, would it be possible to say that the recent outbreak of malaria in Sarasota, Florida was related to climate change? Has there been any research on that issue?
I haven't seen any specific research. What's clear about the different outbreaks of malaria that happened last year is that they were related to the movement of people, like infected people coming into place, infecting the local mosquitoes with malaria. That's one part of the equation. The other part of the equation is, well, the conditions under which people get exposed to those infected mosquitoes. That hasn't been well researched. About the climate change part of it, so for example, something that will be need or that needs to be compared is, for example, changes in the seasonality of malaria. Uh, for example, a lot of the malaria cases historically tend to be like a sort of a summer issue, and actually all of those outbreaks were happening in the summer, no? So if the outbreaks were happening later, no, like let's say now, like in October, November, definitely there will be an imprint of climate change. But a lot of the outbreaks happen during the season that malaria used to happen when malaria was endemic across the US, especially the southern US, up to the 1940s. So again, climate change might play a role. For example, the things happen faster, and that there might be an issue, but again, we don't need to so narrowly think that everything is climate change. Climate change is important, but we need to think on what's making vulnerable populations to the transmission of these diseases.
I'll look holistically of everything, every factor that may be going on. So one
Yes.
other question, have you ever considered expanding your research to include studying vector-borne diseases among displaced or refugee camps outside of tropical or subtropical areas?
Well, that's a pretty interesting topic, and that's again a major issue, no? With so much migration, economic migration ongoing, and economic migration from areas where vector-borne diseases and neglected tropical diseases are common. I personally haven't done it because it'll be complicated, like, and I mean, I'm not in touch with, I don't know, Medicine Sans Frontiers or organizations that might be providing healthcare to displaced communities. But it makes the point, no? For example, like on the facilities to where migrants are detained in the border in Texas, like to what extent is there like a vector control? There is a control and a screening for vector-borne diseases. What's done to prevent any potential transmission from migrants coming into local populations? Well, it's not, I think it's not happening. No, that type of community serving research that can make a big difference is not happening.
Thank you so much. I'm don't see any more questions that have come in through the chat or the Q&A, but I know that you just fielded a lot of questions, and so I really appreciate you staying on and making sure that we get everyone's questions answered. And just a lot of things to think about climate change and the spread of vector-borne diseases and the implications of what's happening in other countries and how it translates to what's happening in the States. So a lot, given us all a lot to think about. So thank you so much, Dr. Chaves, for being here. And if anyone does have any questions about our programming, please feel free to email arcipc@uab.edu. And we hope that we see some of you soon on our future webinars. So thank you very much, Dr. Chaves, and thank you for everyone who attended. Thank you, and lots of congrats and applauses in the chat box. Thank you.
Well, thank you so much, and thanks for the invitation. Happy this happened. Bye-bye.
Thank you. Bye. Thank you.